New Jersey is one of the, if not the most hard-hit area, in addition to New York City. And we've had a very aggressive lockdown in place for some time. And this lockdown has extended to every aspect of people's lives, including healthcare and medicine. My name is Dr. Jeffrey Kornitzer. I'm a pediatric neurologist, and I practice in northern New Jersey. A lot of things have been shut down. For instance, elective procedures. So as a neurologist, the ability to get an EEG to look for seizures as an inpatient is not something we could do. Even getting an MRI has been difficult. For example, I had a patient who I saw with a headache. Most people probably would have, been a little concerned, but it wasn't anything so out of the normal. He had a few signs in him that made me concerned there could be a brain tumor, but his examination was normal. He was walking, talking, doing everything. And it took us actually 2 weeks to find a place to do an MRI. And when we found actually a place to do an MRI, within an hour of getting it, the radiologist called and said, by the way, he has a brain tumor. And within a couple hours, he's already in the ICU being prepped for surgery. He couldn't even hold a fork up. He was shaking so badly, he couldn't stand up with falling to the side. He could barely get his words straight. He was a totally different person. And this was only 2 weeks. He would not have made it another 2 weeks, to put it frankly. Well, like a lot of things, medicine is not different than, I guess, other professions where people want to say the company line, and it feels like the company line is to say that at all costs, shut down everything. So, when we're sitting in our offices talking, the physicians, we all talk about how we know that this is hurting our patients, but people don't want to voice it outward. They're afraid that they're not towing this national company line about how shut down, and ignore everything else, especially in a place like the Northeast. But behind the scenes, I would say that, especially in my field, we're all concerned about the same thing. We've all seen it in a level that's just growing and growing. The problems are growing and growing. So it's undeniable at this point.